The diagnosis of IPF is not a sit and wait diagnosis. I think there's a big issue still with disease awareness, with the dissemination of the new information. It's critically important that patients with pulmonary fibrosis in general, with interstitial lung disease, definitely if the word IPF was mentioned, idiopathic pulmonary fibrosis, you need to be seen by an expert. This is not something that can be seen by somebody who doubles in many other chronic lung diseases, because there's specific drugs, there's specific diagnosis, there is access to research. So all of these things have to be done in specialized centers. This is in some ways controversial, because some physicians will say, how could you tell me that I cannot take care of this patient? And I would never tell them, but I would tell the family and the patient, get information from an expert. Because if you were diagnosed with IPF, there's guidelines for follow-up, for treatment. Your physician and you yourself should follow up the guidelines. Giving the current drugs, handling the side effects is the work of an expert. The diagnostics complexities of pulmonary fibrosis require an expert team. And the last thing is access to research. While there are two FDA-approved drugs, there's many coming, and some of them may be better for you. You don't know. So I would highly recommend definitely not waiting, and making sure that you get expert advice. That's the way. And I would say it again, if somebody says pulmonary fibrosis to you, this is not a sit and wait diagnosis.